Good afternoon, everybody. Welcome. We'll get just a few minutes here while we get folks to sign in and be able to join us today. Appreciate everyone joining us. Hope you're having a fabulous week. We've got a good number of people joining us today. So we'll give them just a little bit of time here to get logged in. I'll mention this again as we go along today, but be sure if you haven't that you go out and check out the Georgia HFMA chapter website at georgiahfma.org. There's a lot of really good education lined up, including some Region 5 stuff I think is going on today. We've got another forum, education forum going on next week. We've got our fall conference, which is virtual, a little bit of combination of virtual and in person this year, scheduled for early November. So be sure to take some time to look at the chapter calendar to see some of the great events coming up. I want to certainly thank all the many volunteers of the Georgia chapter who've been so helpful in keeping things moving along, because it's certainly been different. And I know you all can appreciate that, but hopefully you're managing through everything okay, and figuring out your new normal, but finding some balance amidst all of that as well. So welcome to day 3 of the Georgia HFMA Virtual Payer Forum. My name is Bill Ikest, and I have been the moderator this week for the Payer Forum. As many of you know, I've done several of these with the chapter over the years, and we just felt like it was important to keep it going. We really appreciate you joining us. I know that we're in the midst of a really challenging time. Of course, my preference is always to visit with folks in person, and we've done that in the past, and it's always been a great group and a really engaged group. We feel like it's as important as ever to stay connected with the payers, keep the providers and the payers connected. And so Georgia HFMA has a long-standing commitment to ensuring cooperation and collaboration between the payers and the providers. We want to make sure that we make them accessible and give you an opportunity to ask some of the questions of things that you're facing. The interaction with payers is a little bit different right now, of course, and so we want to make sure that things are going okay for you. So here we are at Wednesday already. Good news is the Atlanta Braves are up 2-0 over the LA Dodgers in the National League Championship Series in baseball. So that's certainly something to be excited about if you're a sports fan or a baseball fan. So go Braves. As you know, each day this week, we've had a different payer, and we'll have a different payer. Tomorrow, we've got Medicaid presenting from 1 to 2, and on Friday, we have Ambetter presenting from 1 to 2. The information from the presentations will be posted on the Georgia HFMA chapter website, either later this week or early next. I'm hoping that United will be able to give me some form of content to be able to share with you. They normally, as you may recall, have some handouts and stuff at the meetings, but we'll see what additional supporting documentation we can get for you from their presentation today. I would ask you, if you have any questions during the presentation today, if you would please go down to the Q&A section and ask your question, and we'll be sure to do our best to get it answered for you. Of course, if there's something that they're not prepared to answer today, we'll be sure to circle back and get you that information. Joining us today, one clarification with your questions, please don't include any PHI obviously in your questions if you're asking something specific. But today we've got United Healthcare, and joining us from United Healthcare is Salim Hudson, Karen Roberts, and Quartus Merkerson, and they are going to take us through the presentation At this point, we're scheduled to go for an hour. We might end up finishing up a little bit early, but be sure to get your questions in. This is a good time for everybody to get some of those questions or challenges or issues or concerns that you have answered, whether it's COVID related or whatever else. But with that, I'm going to go ahead and turn it over to Cara and Cordis.
All right. Thanks, Bill. And hello, everyone, and thanks for having us and joining us today. My name is Cara Roberts. I am a senior hospital and facility advocate, obviously in Georgia. And as Bill said, we do have a few of the other advocates with us today. We have, and I'm gonna hop into one of the other slides there, Salim, where it has the list of the advocates. So that we can make sure that everybody can see who's on our team. You may be aware of this, but our team, previously labeled as Provider Relations, our name has changed. It is the Provider Market Operations team now. We still are the advocates, though. We have your list of senior physician advocates over here on the left-hand side and your senior hospital and facility advocates. So most likely some very familiar names. We've kind of been on this team together, working together for quite a number of years. The way for you guys to decide on who you should be reaching out to for questions or concerns is basically what type of claim form your question would relate to. If it has to do with a claim that is submitted on a 1500, that's your physician advocate. If it's something that is billed on a UB, then that would be your hospital and facility advocates. I probably should have put that at the front, but Salim, let's just go back really, really quick, and I will just let everybody see the agenda real quick and let you know what we're going to cover today. I want to cover some COVID-19 announcements and updates with you, some info about uhcprovider.com and link updates, some new information about the network bulletin. We will touch base on the lab test registry protocol. We all know that's a hot topic right now. I'm going to give you some information about the Georgia State Health Benefit Plan for 2021. And then we're going to finish it up with the service model and escalation process. And I will provide to you, Bill, I do have one of our forms, again, that has all the contact information for our advocates so that everybody can have that. So, Salim, we can go ahead and move over to the COVID-19 info. All right. The one thing we would ask you guys to do, because obviously everything with COVID-19, it seems like it changes all the time. There's new codes, there's new policies, everything that's out there. The one thing we would ask you to do is please visit our website, uhcprovider.com/COVID-19. Whatever information we as advocates have is what's out there on the website. They do try to update it as often as possible. There is one of the items that I would point you to is the summary of all of the different types of programs that we offer. For example, like the cost share waivers or the telehealth programs. If you go to that specific area, it will provide you with any sort of updates that have to do with those different policies. So the first point that you want to go to is that website. If you're not finding the information out there, then by all means, reach out to one of your advocates and ask that question. We may have to outreach to our work group to find out if there is an answer to that question, which depending on what area it is, whether it is a code being added, whether it's reimbursement being added, it may take some time for them to get back to us and let us know what the status of it is. But for the most part, they're usually pretty good about getting back to us within like 3 business days that I've seen recently on responses. So that's where we would ask you to go. So we can go to the next slide. This is just, and all of this, and we'll send this over to you guys. Everything that's in here that is underlined, like the summary of COVID-19 dates by program, it's all, they're clickable links that you guys can gain access to. This is that summary that I was talking about. It does provide you with all of the programs, but these are ones in particular we wanted to make sure you were all aware of. These are very recent updates for Medicare Advantage, for example, for the testing and treatment cost share waivers, which obviously is co-pays, co-insurance, and deductibles. That is for in-network and where it's covered as out-of-network visits. They are going to be covering that cost share until December 31st. So that is a new update that came out. Now, as far as the commercial, down at the bottom there, you'll see we're doing the same thing with commercial. Be mindful that that is for fully insured. The self-funded customers, it is on an employer group basis on whether or not they have decided to follow the cost share waiver program. And that's going to be for in-network treatment, has been extended to December 31st, and out-of-network cost share waivers will end on October 22nd. So just some really important ones to keep in mind there. And then the other one we want to touch base on is just the HRSA for the uninsured program. We want to provide you guys with the basic information, but please know that when it comes to questions and concerns relating to this program in particular, United Health Group as a whole, we have been required by HRSA for everything to go through that dedicated provider call center number, the 866-569-3522 number. So please make sure that you are calling them. Now, I know our VP is very involved with this program, but, and I've asked certain questions like how long it takes, are they able to give responses right on those calls that you make? It depends on the situation. For example, I have had one where there is a newer code from CMS, but there is no pricing information that has been given in order for that code to be reimbursed yet. So as soon as the reimbursement information is released, HRSA gives the okay to United, and then it is loaded in the system for those claims to get processed. So that's just a certain situation that I know can't be taken care of during the call, but everything goes back to HRSA. There is a log that they keep for every single call that is made. Other than that, the microsite is available, and they do have frequently asked questions that are located out there. So, I mean, and I can't stress it enough, just making sure that you guys call that call center and knowing that everything is getting back to United Health Group on those calls, and it's going to HRSA, and they have daily meetings to discuss this program and those calls on items that they have to touch base on. It's just not information that we can provide as the advocates. We're not permitted to because it's HRSA's requirement. We can go to the next one, Salim. I think actually before we touch base, Bill, let's see if there's any questions relating to the COVID-19 section.
No, nothing on that just yet. I've got a couple others that we'll get to later on in the presentation. Thank you.
All right, sounds good. All right, moving on. UHCprovider.com. Hopefully everyone has gone out there, and I know everybody's very busy. Obviously, this year has been extremely busy for everyone, but UHCprovider.com is a great resource and tool for you guys to use. I love the search function on this website from the previous website we had. This one, it works very similar to our internal system. The previous website, you couldn't, for example, put a CPT or HCPCS code in and then have it pull up all of the policies that it applies to. For the most part, that is what this new website does do. However, keep in mind, like we had one just yesterday that we were discussing. It was a J code for oncology. Since there are so many J codes, instead of each individual code being put into this one particular policy it applies to, they have the range of codes. So instead of a code, if you're not finding a policy, make sure that you're putting in maybe the name of the drug, or you're just, the other option is, and we can go to the next slide, Salim, by utilizing the menu that's on the left-hand side, you can also narrow down what different areas you're looking for. Maybe you're looking for prior auth and notification. So from that menu, there is a direct link over to that section that you can click on, and it'll take you to it. It seems a lot more user-friendly, but also keep in mind we do have over on the right-hand side of the website a feedback button. If there is anything that you're struggling with on that website, you know, make sure that you put that feedback in there, because these websites and all of these tools that we have out there for you guys, it's created based on the feedback that we receive from you. We can go to the next one. All right, so along with uhcprovider.com, I want to give you some link updates. The first one we're going to cover is Optum Pay. There have been letters that have gone out about this, and there's been other announcements in our network bulletins, but throughout the remainder of 2020, United Healthcare is going to be phasing out most of the paper checks for payments on claims. So if you aren't already signed up for the direct deposit, which of course is our preferred method of payment, keep in mind that you may start seeing virtual cards coming through instead. If you need to go online and enroll, it takes less than 10 minutes to do so. And you can see right here a list of some of the items. Just make sure that you have those in front of you when you're ready to start the process. And there's two different ways that you can get to that section. You can either go to uhcprovider.com to the menu, resource library, link self-service tools, and then Optum Pay, or often with a lot of these different programs, you can just do uhcprovider.com/ and then whatever that program is, like this one, Optum Pay. So if you do still receive those paper checks, make sure you go out there and just take action on that. Otherwise, you will start seeing those virtual cards. And the next one is Track It. So Track It is our new tool out there on Link. This tool, I think this tool is really cool for a couple of different reasons. For the most part, you don't have to go into Claims Link and pull up each individual reconsideration that you have. You can go out to Track It, and it'll show you all of the reconsideration tickets that you have submitted and provide you with a status of them. The other thing I like is pended claims. So if claims have pended because we need some sort of documentation, you will see a list of the pended claims out there, and you can take action right from there. And that is ideal, especially for anyone who works in the bigger health systems where you have so many different offices and, you know, you aren't sure where those letters are going to. So a very good area for that. The other one that I like how this functionality works is for each individual health system, we also are picking out high-profile claim alerts. This is based on reconsiderations you've submitted, appeals, calls that you've had to place to United Healthcare. If it is a common claim that we see, then we created this high-profile claim alert to say, hey, you have another claim that's very similar to maybe a call you've made previously or a reconsideration ticket. We just want to let you know that here we're seeing another one. you might want to take a look at it and see how it's processed and see if you want to take any action on it. So, and it's just based on the activity that you all do on Link. So very important to just keep utilizing Link. We can go to the next one. Well, before I hop into that one, Bill, you want to let me know if there's any questions? Or we're good.
Let me go ahead and ask this one question that came in early on. Can you explain why CPT and HCPC codes are not descriptive enough that the provider also needs to register? I'm sorry. Please explain why CPT and HCPC codes are not descriptive enough that we need to register all of our lab procedures. So I think what they're saying.
Okay, so we're gonna, we're gonna get to the lab test registry protocol. So I think that's probably what they're referring to. So that's going to be on an upcoming slide. I mean, I'm not going to be able to go into specifics about that. However, it is out there on our website and provides you probably the answer to the question they're looking for.
Right.
And I'll touch base on that one.
Okay.
All right, Salim. Okay, so the network bulletin, very brief here. As far as the network bulletin slides are concerned, but just making sure that everybody knows our network bulletin publications come out on a monthly basis, usually on or around the 1st of every month. This bulletin is really important. It provides you with important protocols and policy changes, a lot of stuff that can impact your office. If you're not signed up for it, I would highly encourage that you go out there, and on the next slide we have the link that you can go to. Now, my suggestion is for everyone to go out there. Even though you already may receive the email for the network bulletin, they have a lot more options now listed under this subscribe portion. For example, you might be somebody who works directly with the pharmacy department. There is, at least the last time I checked, there was an actual link that you can click on to receive any sort of pharmacy-specific updates, prior authorization and notification updates. So you can specify exactly which area you'd like to receive some important network news from United as well. The other reason why it's very important to do this is in the October Network Bulletin, they did post out there that the PDF format is going to be going away as of January 1st. So everything is going to be right on our website, and it's going to send you to all of the necessary links that you need for any of those updates. So very, very important to make sure that you're signed up for those, because those PDF versions won't be sent out anymore. We can go to the next one. I think the next one, okay. Of course, the hot topic that we've been hearing on our team lately, the lab test registry protocol. So first and foremost, just be aware that out on the website, there is a quick reference guide and there's 2 frequently asked question guides. We are aware this is a hot topic. I can tell you that we know that there is additional discussion that is taking place even at a leadership level for this protocol. But until our leadership comes back and tells us any different information, or if the protocol does get delayed at all, right now, this is the information that we have as advocates to provide to you. Now, as far as the coding is concerned, it does show that information out in the FAQ there's 2 of them. There's one for the protocol as a whole, and there's also one for the tool. In the protocol, that is one of the questions that is asked out there, and it is asked on specifically what is the lab test code, like what are we looking for you to register. So that information is out there. Also, now this slide is supposed to be geared more towards letting you know that there is a live training. I have attended this live training, and our trainer, Michael LaBelle, he covers that information with you even at a deeper level when you register for it. So you can get this when we send this presentation out, or if you go to our website and you go to the lab test registry landing page, there is a little blue button down at the bottom where you can register for this live training. It's every Tuesday from 1:30 to 2 o'clock, and they're doing it from now through the end of March. I can just tell you from me being on it, it was very helpful. Michael stops and answers questions while he's doing the training. So he will touch base on any type of question that you have. And he does cover all of that information. In the meantime, if you guys have any questions or concerns, I mean, by all means, you can let us know as your advocate, but there is also this email address where all of those should be sent to. So if you send them to us as your advocate, we will forward them to this mailbox because that is the team who is supposed to be responding to any of the concerns. I know I've had a couple of technical ones with the bulk upload and everything that I've had to send over to that mailbox, and within a couple of days, they had the issue taken care of and resolved. So they're very, I've only had at the most 3 days of waiting for them to respond, but in the meantime, they were actually working on the issue. So I wasn't waiting on them to pick the email up. It was just working on the issue and then responding. So I am aware that this is a hot topic and probably there are a bunch of questions that people have on it. But what we have is honestly what's out there on the website right now. And I know that at the state level with leadership and everything, they are having ongoing meetings and discussions with different associations. So I don't have any status on those meetings. And if there's any changes, you honestly would probably get that information the same time we would in the network bulletin if there is any changes. I'm sure there's questions on that one.
Well, so there's the answer on the FAQ regarding the need for unique identifiers is really only valid for unlisted codes, is what was indicated, was what someone indicated. I can give Donna, I can give you the ability to ask your question through audio if you'd like. Just let me know and I can give you that. Hang on just a minute. I'm sorry, hold on for me just a second. Hang on for me. Just trying to pull that person up here so I can give them the ability to ask their question if I can find it. Well, I saw her before, but let me. I apologize. Let me see if I can, hang on just a second. Another says that my understanding is all codes that will bill on the claim with the exceptions list, with the exceptions listed, is on the website. Is that correct? Let me make sure I'm reading the question correctly.
Yeah, can you reread that?
Yeah, the question was comment was, my understanding is all codes that will bill on the claim with the exceptions listed, exceptions are listed on the website.
The website has the basic information. I'm not and I'm looking really quick to see if any of those documents have a listing of the codes. I know it gives you some basic information. I'm looking really quick here. I don't believe there is a list.
Okay.
Unless, of course, they've added something out here that I'm not aware of. And I know that's not something that Michael in his training, like I was on yesterday's training, he does not bring it up that that there's a list out there at all. I don't know if they saw that in, hold on, there's 3 different documents, so I'm pulling it up real quick to see if it's in one of them.
Okay. I'm Donna, if you can hear me, do you want to go back and ask your previous question? And for any clarification, I think I've given you the ability to talk.
Sure, I can hear you, Bill. And it wasn't really a question, it was a comment. So I apologize if that was misleading, but the comment is that I've reviewed the website pretty thoroughly, including the FAQ. And there's a reason given for the what United feels is the need for those unique codes, but it's not really valid except for unlisted codes. And you know, it does make sense for unlisted codes, although I think there's probably a less administratively burdensome way to do it. But it just, you know, to require that of all codes, even when the industry standard code is certainly sufficient to identify the test, it is just not a reasonable requirement. And I have been involved, or not really involved in the conversations, but have been involved with the people at the AHA that have had conversations with United. GHA submitted our concerns as part of a letter from 26 hospital associations objecting to the policy. And we certainly hope United's reconsidering it, because particularly right now, the administrative burden, which appears to be unnecessary, is really more than the hospitals, and I'm sure the independent labs. I can only speak for the hospitals, but it's certainly more than they can bear at the moment.
Right, and that's the part where I'm saying that there's discussions with leadership, Donna, and the letter you're speaking of is one of them that I honestly was only made aware of on Monday. As you know, you met with Greg and Barbara, and that's when I was made aware of, was on Monday. So I do know that from the teams that are handling that letter, it's being done on a state-by-state basis as far as meeting and pulling in hospitals to represent each state to provide their feedback on it. I don't have any other information on that topic or where they're going with it. All we have, like I said, is what's out on the website and what we're provided as advocates. If they do decide to change anything or postpone anything, of course, we will let everyone know. But until they tell us that, because we're not the decision makers on this protocol, you know, this is the information that we have to provide and to hand out to the laboratories that will be doing this.
Cara, I think what I would say in response to Donna's comment is, instead of being reactive, have the people that are oftentimes closest to the providers with these issues be proactive and let it be known to the powers that be that you know, as Donna mentioned, the administrative burden to the hospitals is quite extensive. And, you know, the challenge is that, is this really necessary? And so that would be the message to, you know, to say, you know, you guys are the ones that are oftentimes closest to the providers with a lot of the issues that they have, that in the call center. So, you know, let them know that, that the providers certainly object to having to go jump through some of these additional hoops. It is causing a lot of additional work.
And let me just
absolutely,
add to
Bill.
that.
I agree with what you said, and I'll tell you, I was shocked that there were senior leaders at United that didn't even know about the policy. So they didn't only not know we had objected to it, but they didn't know about the policy. And that it's just hard to imagine a company like United would have that situation. So I understand, Cara, that you're not responsible. I was really addressing your comment that there was information about the need for those codes on the website, because there may be information, but it's not valid information except in the case of unlisted codes.
Right, and I'll just say I know the individuals, as far as that you're speaking of, that weren't aware of this. They're not ones that obviously are directly involved with the decisions on the protocols. But yes, Bill, and the way around that is, and just so you know, it's the only reason we only just found out about the letter is because it wasn't sent directly to our market. It was at the corporate level. If there are hospitals or labs that are objecting to this, absolutely, they need to send us an email and let us know that they object to it. We do have a process in place for putting that out there. But from what we've received thus far, and I know of some of the letters like the one that Don is mentioning, I know that's being handled at a much higher level with leadership right now, and they're having ongoing discussion. But if any of the hospitals would like to they have to put it in formal writing in an email to us and give us some reasons of why, you know, they would like to object to it. That's absolutely fine, and they can send it to us, and we can log it into the system so that they are aware that that hospital does object to it.
Okay.
So absolutely, you know, with our relationship with you guys at the hospital level, by all means, if you want to send that over, then go ahead and do that.
Okay. All right. Don, I'm going to put you back on mute if that's okay. Go ahead, Cara.
Sure.
All right, we can go to the next one, Salim. All right, so I wanted to provide you just a high-level overview of the Georgia State Health Benefit Plans for 2021. We're going to touch base. Let's go to the commercial one first here, Salim. So we will continue to offer the HMO and the high deductible health plan with the HSA benefit plans. The group number is remaining the same, the 902786. And very similar to previous years, no primary care physician or referrals required. And the preventive care is covered at 100% in the network. There's some other key items there. Most of this from our contact has stayed the same for both of the plans for 2021. Not many changes. We can go to the next one, Salim. This one just to give you some of the key items like copay information, any sort of info about the deductible and co-insurance for the two different products. And then, of course, we always want to provide any sort of updates when it comes to the hearing aids, what is classified for the children and how much is covered every 4 years, and then for the adults as well every 5 years. So that's some info she sent over. Then we also have for the Medicare Advantage, we will continue to offer the 2 plan options, and there's not going to be any benefit changes for 2021. So everything from last year will remain the same. Also, just remember that if you're contracted for our commercial line of business and you're not contracted for the Medicare Advantage, if you do see a state health benefit plan member, their claims will process at their in-network benefit level since you are contracted for commercial. So keep that in mind as well. And then the next slide just gives you a quick overview of some of those deductibles and copay information with the 2 different types of plans, the standard and the premium. And we'll get this info out to you guys so that you have a copy of this. Any questions on state health benefit plan at all?
No, is that your, I forget, is that your last section or do you have one more section?
This is the last section right here.
Okay. Okay. I do
And
have
I
a
can make
couple.
this very, very fast.
No,
Okay,
you go ahead.
so-
We've got time. We've got time. I'll just circle back. We had
Okay.
a couple follow-ups on the lab discussion, so go ahead.
All right. So the UHC service model, we just want to cover this really quick. It's always kind of a hot topic that we have as advocates that we receive with emails. Keep in mind when I use terminology such as reconsiderations and appeals, especially that word reconsideration, it's for the lines of business that you all are contracted for. If it's a line of business you're not contracted for, you will often see, instead of the word reconsideration, you'll see the word appeal. So just keep that in mind as we go through this. If you are contracted for one line of business, you would follow these steps for all lines of business, because your provider, market operations team, and the service model are there to support you if you need assistance. We don't sit there and say, well, no, you're only contracted for commercial. We'll assist you with the Medicare Advantage as well. So if you come across a claim issue and you don't agree with it, these are the requirements of what you'd have to follow. The first step to issue resolution is to follow the service model in submitting a reconsideration. Again, if it's something you're not contracted for, it'll show appeal online. The preferred method is going to the Claims Link app on Link. So we would prefer that you do this. It does allow you to add any comments you want to that situation and that claim issue, but also attach any supporting documentation you may need to submit. You can also update it if you need to add additional comments, and you can also resubmit if you need to do so. We've had that a couple of times. If documentation has been attached and maybe the file is corrupted or whatnot, they are able to resubmit under that same ticket number rather than having to create a new one. So that is one of the functionalities that's available out on Link. The other two options are going to be calling provider services to our main number there. Remember to make sure that you tell the rep, even though they're pulling up the claim information and they're letting you know how the claim processed, you need to make sure that you say to them you'd like it to go back for an additional review and explain why you don't agree with that. If you are only calling to get claim status, that doesn't count as following the service model. You need to specifically say, I want this claim reviewed again. Now with this option, obviously you can't attach any documents. You can't resubmit like on Link. We do ask you to allow up to the 30 days to process the request, and that is dependent on the complexity of the claim issue and also the line of business and departments that have to review it. Make sure you get your call reference number. Right now, I believe they're still giving those D reference numbers. They used to be the really long 15-digit ones, but now they're just giving you the last 4 digits. And then the other option is submitting it via mail. And we do have out on the website a copy of the reconsideration request form and also the address that you would send that reconsideration to. Now let's say you've done all this and you still don't agree with the outcome of the claim. So you're thinking, what's my next step? For us, we ask that you follow the escalation process after this, and that is coming to our team. So we can go to the next one. So this one, everybody hopefully has a copy of what we call our impact claim upload template. When you have that template and you have a claim issue, you can have 1 claim, you can have 20 claims. It doesn't matter how many claims you have. You put all of the information on that template. There are specific fields that are required and then other ones that are optional. Provide all of that information and send it over to our mailbox here. This is our team mailbox, southeastprteam@uhc.com. Once you submit it over, just be aware you'll receive an automated email initially. But then you will receive a follow-up email afterwards from one of our teammates who has reviewed your email. And if there's additional information they need, they'll let you know. But hopefully everything is on that spreadsheet. And what they can do is create a case number, and they'll provide you with that case number. The team will review everything that you put on there for those accounts. And then most of the time it's via email that they'll send you back a resolution for those accounts. However, there are times they also do call you because maybe they'd like to explain something to you as well. But by all means, you'll get an email with the details. There just might be an additional phone call too, so they can talk to you. If you, for any reason, disagree with what they send over to you in that email, you can communicate directly with that individual who sent it over to you. So respond to that email. Let them know that you disagree with it. You know, make them aware of it. And by all means, add your advocate to that email if you need to pull us in on it so that we can also provide some assistance with that. Many times when that happens, I know on my end, we may even that same day or the next day get on a call real quick, myself and the team that actually reviewed the claim, so we can talk it out and figure out exactly what's going on with it so we can provide you with a follow-up response. So they're very easy to work with as far as any kind of disputes that you may have on a particular case.
And make sure any information you send
thing,
is password or encrypted.
What was that?
Just make sure any information that's exchanged by the provider is encrypted. Just make sure you don't include any open PHI in any of that. Just a reminder.
Right. Yep. You guys can send secure emails to that mailbox. They are able to open up the emails. They set up very specific passwords for our teams so that we can open those up. You can put passwords on the spreadsheet if you need to. Just obviously remember to send a follow-up email with what that password is so that they can open the spreadsheet up. Now, the other thing that this team will do after they review it is they will let you know whether or not you need to submit additional documentation, a corrected claim. They'll point you to a link out on CMS if need be, or out on our website with a policy. And then the last thing is that they will also tell you whether or not your only next step is to submit an appeal. So it's very important to know that this process is in place so that we can try to make sure that everything is taken care of before you have to resort to even doing an appeal, because, I mean, most people are aware you have specific language in your contract, and if you get to that appeal process, most of the time it's the final decision that's made, and we don't want to see you miss out on getting a claim payment if it's due to you because you've gone to that appeal level. So please, I can't stress enough making sure that you guys are following that service model and escalation process with us before you go to that appeal level. And that should be the last slide, I think. Yes, Salim? I think so.
Okay.
It is.
Great.
That's what we have, so we can open it up for some other questions.
Yeah, please, folks, again, at the bottom of your screen, if you would, just in the Q&A section, type any additional questions that you have. A couple things that came in. Cara, back when we were talking about the lab and Donna's comments about the additional requirements from United, if someone wants to communicate their concern or their objection to that, who do they direct a letter or a communication to that you referenced? Who should those, if they send something out, who should they direct it to?
Well, there's two options. One, you can either send it, if you're like a hospital, for example, you can send it to your hospital contracting team. That's one option. The other is also, if you're a hospital and you know who your advocate is, which is either myself or Coordis, you can also send it to us via an email. That's the fastest route so that Coordis and I can go ahead and log it out on the system so that that team is aware of it right away. So those would be your two options. I'm not sure if that individual knows who their advocate is or their hospital contractor, but we can definitely touch base if you need that information.
Okay. Yeah, I would definitely suggest connecting with your contract manager internally as well, just to, kind of, they may have some details about that. They may be working on it themselves. Who knows? So just a comment again related to the lab. All lab codes that will bill on the claim should be entered in the test registry. The exceptions are genetic and molecular tests. That was I think that was really just a comment. And then let's see what else we've got coming through here. I'll give it just a minute here. I think that may have been the last question. So, yeah, let me. Cordis or Salim, did either of you have any comments you wanted to add before we close it out?
I did not, Bill.
Okay. I would just ask the folks on the phone, please respond if it's appropriate, but, she gave you several options for following up on claims, escalating claims. Are those processes working? Are there bottlenecks? Are there issues that you're experiencing that are preventing you from getting the status that you need on claims? If you're good with that, great. One of the common denominators that we've heard this week from the payers who've presented is take advantage of their online capabilities for claim resolution, as opposed to going through necessarily the call center or whatever. So check on that. I got a partial question here from hospice claims are often denied. Let's see, I'm not seeing the full question. Can you explain if that is, I'm going to guess, is that something that's being addressed, or is that something that you guys have seen come up a lot, or any comments as it relates to hospice claims, anything that might be preventing those claims from getting processed timely?
The ones that I have seen, there are specific, and again, I mean, that may be very specific for that group, and you would definitely need to follow that service model and escalation process. But I can tell you, in my experience in looking at those claims, it has to do with the way the claim is billed based on CMS guidelines. That's what I often see. We've even seen that, Salim, on some of those the physician-related claims. I think that you've had before, but it all depends on. I know you're saying often denied. That's the only thing I can think of that you're speaking of, is that it's the way the claim is being billed as far as the date range is concerned. And then what the guidelines are out there from Medicare. Any other type of denials, you might be speaking to something very specific for your group, and we'd have to kind of connect to see what's going on with those.
Right. Okay. I asked for any further clarification on that, if there is any, but as of, let's see. Yes, so can you explain when the patient is switched from inpatient to hospice, so that that next step, that process, those claims are often denied? If you can be more specific and just say what the denial code is that's coming back on those, maybe Cara or Salim or Cordis can speak a little more to that. I apologize. I just want to make sure we get you an answer.
I think it's the one that I'm thinking of that they're mentioning, as far as it has to do with the date range. If the inpatient claim has the same discharge date as the hospice start date, then that's where there's issues on those claims. And we have links to the CMS website that provides specific instructions on how those should be submitted over and who covers what. So if they want to, I'm not sure which facility they are a part of, but if you want to touch base with us, we can definitely get you that link with that detailed information.
Okay. Here's another question. When submitting appeals through Link, we're not able to track them through Link. We have to call to get status. Is this because we're not in contract with certain products, or what would prevent them from being able to get the claim status through Link?
Yeah, appeals, we are not permitted to provide the tracking details out there on Link. Reconsiderations we can, but appeals we're not permitted to. So if you have submitted an appeal, the two options of what you would receive is either, if the appeal is overturned, obviously a new PRA with the claim being reprocessed, or you'll receive a letter with the outcome. If you do need status on it, then you would have to call provider services to request status on that appeal.
Okay. Certainly not ideal, I would imagine, but maybe that's coming at a later date. Who knows? It seems like you and other payers would prefer to direct folks as much as possible to the online capabilities or the online resources. As you know, in the past at these payer forums, we've often heard from folks about the inconsistencies of the answers that they receive. Sometimes I'm not picking out United specifically, but people, when they call the call center, have gotten inconsistent responses depending on the rep that they talk to. So I would think certainly that the online capability would be ideal. Okay.
Yeah, and they are working on that. They just don't have a date of when that will be rolled out, of when they can do that quite yet. But they are, believe me, COVID-19 has kind of delayed a lot of things that they've been working on, and that was one of the items. So it looks like that individual with the hospice question, you're from Emory. Cordis is your HFA when it comes to that group. So if you followed the service model and the escalation process and you still have questions on those particular denials, then you can definitely reach out to Cordis. We'll provide everybody's contact information, and I'll make sure that Cordis has a copy of that link to the policy that provides you the details for those claims.
Thank you, Cara. Okay.
You're welcome.
Yeah, great. Good information today. So thank you. I had a couple things I wanted to share on my side. So I'm going to drop off of yours, and I'm going to move real quickly to a couple things I just wanted to show folks on this. So this is the Georgia HFMA website that I'm showing right now. And there, I mentioned at the outset of the webinar, the calendar of events. I really encourage you to look at that. But as in regards to the sessions this week, what you'll do is you'll go over to the media tab. You'll go down to document library. You'll click on document library, and you'll go down and you'll see a section called In Case You Missed It. Double click on that. It'll give you a 2020 folder. And then what we'll do is we'll have a virtual fall payer forum folder set up, and the presentations for each of the payers this week will be included in that. Again, I have to work out here with United on what they're able to send us. They have some internal policies that might limit the amount of detail that they're able to share with us, but whatever they are able to provide, we'll be sure to get that out there to you. So with that being said, we're coming up on our time. I want to thank everybody for their participation and for their support of Georgia HFMA. I want to thank again our corporate sponsors for Georgia HFMA, certainly whose help, whose support we couldn't go without. This is a unique year for everybody, and it's important that the chapter be able to stay connected with the members and be a resource for the members. And we just really thank all of you for the work that you're doing in your individual organizations. It's certainly been a challenge, something that you didn't anticipate and you weren't expecting, but I would encourage you to just keep on moving. We're going to be out of 2020 here before we know it, and hopefully 2021 will be a little bit better. But I wish you all well. I do have a question that has just come in. Let me make sure I ask this of you before we get away, you guys. Is there anything that can be done about the months of holding claim by the Global Home Plan? Are you familiar with that? Is there anything that can be done about the months of holding claims by the Global Home Plan?
So when claims are getting held by global, they mean the international employer groups. You know, United has to wait for the international employer groups to give us permission to process those claims. So, you know, honestly, it's in the hands of the employer group of making sure that they review those claims in a timely manner. If they need documentation, that they request it in a timely manner, and then obviously providing United back with a response that it's okay to release payment on it. So I know the issue that they're speaking of, but it's basically in the hands of those employer groups.
Okay. All right. Well, with that being said, I think we have come up on our time. And again, just want to thank everybody for their participation. Tomorrow we have Medicaid at 1 o'clock. We hope that you'll make plans to join us. And again, I wish everybody well, and thank you for your support of Georgia HFMA. Have a great afternoon and a great evening. We'll hope to see you back here tomorrow. Thanks, everybody.